Exercise and going back to the gym are very big, important topics that patients always want to know. If they can return, when they can return, what exercises can I return to, which exercises should I not go back to. And this is often the one discipline, the one type of thing that patients tend to not take the advice of the clinician. They tend to go back too early and tend to go back too soon and too aggressively. But by and large, the simple answer is no. If you're having acute or an instability in your back, it hurts quite a bit, really struggling with your back, with your functional ideas and functional tasks, and can barely get through a work day, you're probably dealing with a back that needs almost the opposite of returning to the gym. You almost need a rest period. The acronym is called PRICE, P-R-I-C-E, for pressure, rest, ice, compression, and elevation. Any 2 or 3 of the 5 usually will be suitable. But by and large, going home, resting the back, using ice and using some sort of a pressure, or maybe lying in the right positions to give you some pressure to the back. Elevating if there's a swelling issue is usually indicated. Working out, lifting weights, going to the gym, number one, it's going to heat up the tissue. Just inherently, when you're moving around quite a bit, you're going to warm up the tissue, and often too much. The area is already hot to begin with. That's why you're suffering a bit. And number two, you're going to increase the disc pressure by lifting weights or carrying the weights around, lifting them up over your head. So a combination of heating up the tissue more and increasing the pressure on the spinal joints and the discs can further exacerbate the problem, and at best, just slow down the healing process, which is not what you want either. A simple rest period of 3, 5, 7 days, depending on how bad it is usually indicated, and then a slow return back to exercising is usually the goal. If you're in a physical therapy program, they would advise you of the same thing depending on your symptoms, and probably give you some tips and some exercises to get back to sooner than later. But as a general rule, give it 3 to 5 to 7 days depending on how bad it is.